Hello, fellow medical colleagues. My name is Yasutaka Yamauchi, and I am the director of the Cardiovascular Center at Takatsu General Hospital in Japan. I am very honored to be posted on the JVIR YouTube channel. My treatise is about the independent predictors of major adverse cardiovascular events at 3 years after aortoiliac stent implantation. To begin, we know that peripheral artery disease is closely linked to advanced age and various lifestyle illnesses such as type 2 diabetes, smoking tobacco, obesity, and dyslipidemia. On the other hand, endovascular techniques have progressed in recent years, and endovascular therapy for aortoiliac region is now considered to be the standard interventional modality that is as well established as percutaneous coronary intervention is for coronary artery disease. However, there have been no large-scale prospective studies that have evaluated the risk of MACEs after aortoiliac stent placement. That is why we need to identify risk factors for MACEs in real-world practice 3 years after aortoiliac stenting for symptomatic PAD. In the Omotenashi study, data was analyzed from a multi-center prospective registry in Japan from April 2014 to April 2016. 64 facilities participated. Now let's take a look at endpoint. MACEs were defined as a composite of myocardial infarction, stroke, and all-cause mortality. The primary endpoint was MACEs during the 3-year follow-up. Let's move on to our patient characteristics. As you can see, the mean age was 72.6 years old. Hypertension came in at 94%. Dyslipidemia sat at 82%. Diabetes was 48%, and dialysis was about 13%. From this slide, we can see the CLTI rate was about 7% and pre-ABI was 0.69. CTO rate was 39%. The calcification made was about 80%, both the CTO rate and the calcification being quite severe. Next, let's take a look at the Kaplan-Meier analysis of the data. The data showed an 89.1% rate of freedom from MACEs during 3 years, which was high compared to the previous retrospective studies. The present study reviewed the results of treatment in actual clinical practice. The multivariate model shows that advanced age, renal failure on dialysis, myocardial infarction, stroke, and ipsilateral femoral popliteal regions were independently associated with the risk of incident MACEs. In conclusion, a 3-year rate of freedom from MACEs after iliac stenting was reported. Age, renal failure on dialysis, myocardial infarction, stroke, and femoral popliteal regions are independent risk factors for MACEs at 3 years after aortoiliac stenting. Thank you for your attention.